Serpentine follow tines. Today we're going to learn how to move our organs in our upper abdominal cavity, specifically the liver on the right side and the stomach on the left side. Just to review, they sit right below the diaphragm that goes all the way around the back, and the liver actually goes all the way around as well. The stomach goes down to the left side of your belly button. The liver has ligaments that go behind the belly button as well. And so we're going to discuss, before we learn how to move our organs, just going to review how to properly breathe. Remember, when you inhale, you want to feel the diaphragm move straight down, not forward, but straight down like a plunger. And if you're back breathing, you feel your back breathing, you feel the floating ribs open and close with the breath. That will help you to get the diaphragm to move straight down. Also, when we use our transverse abdominis muscle, which goes from the pubic bone to the lungs, and you really feel that expansion of the belly button and the abdomen on the inhale, and as you exhale, you squeeze in. That also helps the movement of these organs. So to go through how to get our organs to move and to feel them, to feel the vibrations, put your right hand over your liver, your left hand over your stomach, very gently, hardly touching your body. The harder you touch, the less you'll feel, actually. And when you do this, you want to just start to listen with your hands and not with your brain. You can do this standing up, sitting or lying down. And what you want to do is just listen with your hands, and you start to feel maybe some heat. Maybe you'll feel a pulse. Maybe you'll feel some vibrations. When you start to feel connected a little bit to the inside of your body and the organs, you can start to open up your palms and your fingertips a little bit, and maybe move your hands around just gently. And you'll start to feel almost like a magnetic pull. And this creates a negative charge in the organs, which is very helpful for their health. In this first slide, we can see the liver crossing anterior of the stomach. Notice how these two organs sitting partially within the rib cage would benefit from good respiratory voluntary actions. The liver and stomach's close relationship involves a shared important blood vessels and nerves, specifically the common hepatic artery and the left vagus nerve. In this slide, we can see the close relationship of the diaphragm with the liver and stomach. The diaphragm seems to be at rest in this picture, which would be functionally on the exhale when the diaphragm rises to decrease the thoracic cage area, increasing its pressure to allow carbon dioxide to be expelled. This is the hand placement for the stomach and liver. Remember to feel with your hands and not your brain. The liver extends to the back of the thoracic cavity, so recruitment of the serratus posterior inferior muscle, active with exhale, keeps the upper thoracic organs moving well. The lesser omentum is the double layer of peritoneum that extends from the liver to the stomach. It is filled with nerves, blood vessels, and lymph to aid the stomach and liver's function. It also profoundly affects the pancreas and the duodenum, which is the first part of the small intestines. With a big belly inhale, the top of the liver tilts anterior. The falciform ligament gets pulled by the navel as the transverse abdominis muscle, the deepest abdominal muscle, relaxes and expands. The falciform ligament of the liver is an extension of the anterior and posterior liver ligaments that join to extend downward posterior to the navel. The transverse abdominis muscle needs to relax on the inhale, expanding the abdomen, and engage on the exhale, squeezing inward.